So Hastings Health Centre is what we call a one-stop health and urgent care primary care facility. So we have two sites. We have our large site in Hastings and then we have a smaller site in Havelock North. We've got 33,000 enrolled patients and so those patients are split across about 24 permanent general practitioners and then a large multidisciplinary team that supports those GPs, and then we also have our urgent care facility which sees about 110 to 120 patients on average a day. One of the things that we had was we had a bit of information through the mandated patient experience survey which could give us an idea of what our patients were saying, but what we couldn't see is what the breakdown of demographics of those patients were. We couldn't see who the providers were that those patients were seeing, be able to compare what was happening in different areas of the organisation, and then also we only could see what was happening on a couple of weeks per quarter. And what we wanted was something that was real time, where we could find out straight away what was happening with what our patients were telling us. So if we made a change, we wanted to be able to see that in feedback straight away. And so that was the biggest challenge that we were facing and that we wanted a solution for.
So for a number of years now, I have worked in the patient whānau feedback space. We have always used the National Primary Care Survey. It is a big survey. It takes a long time for people to complete the survey. You need to have reasonable levels, I think, of health literacy to complete the survey. And it's quite cumbersome to pull the data out that you're looking for. So when the Ask Your Team patient voice was put to us, I could see that we were going to be able to ask a much smaller number of questions. It was the simplicity of it, that we were going to continuously survey our patients and their whānau, and we were going to be able to get on-time data so that when we do make improvements, we can then measure those improvements and see how we're going.
What we were immediately blown away by was the response rate that we got. So the number of patients that we get giving us feedback every day was huge. It's much more than we've ever had before. The other thing that we've really been able to do, especially through some of the narrative and the comments, is to understand some themes around where we could improve. And the other thing that we have started to notice, and it'll be interesting to see if this continues, is actually a reduction in our complaints, because people are able to give feedback and they're able to give it at the time and be able to voice what we should improve on.
Once you have the information from Ask Your Team, and we get a lot of information, but it's really easy to see those trends. They pop up very quickly and they're very easy to look at. And so as an organisation, one of the things that's really important to us is quality improvement, but a key part of quality improvement is being able to concentrate on the right problem. Are the quality improvements we're putting in actually going to fix the problem we're trying to solve? And then once we put in those quality improvements, how do we know that that improvement has actually made a change? So what we would expect to see, what we hope to see, is that we put in improvements, that we start to score better in those areas on our Ask Your Team patient voice. With our privacy rules, our patient management system, it's quite complex on how Ask Your Team are able to get that data. So we worked with them and our patient management system to understand how that data can be extracted. But Ask Your Team really did all of that for us. So whilst it's a complex environment, it was very, very easy. I'm not a techie, but actually Ask Your Team did that all for us.
Yeah, I'd recommend Ask Your Team to all health organisations that are really wanting to understand what their patients are saying. I think the simplicity of the tool and the real-time feedback that we're getting is just so valuable that I think all health organisations would get value out of it too.